Hello, my name is Corbin May, and this will be my presentation on America's opioid crisis. Do we have a crisis? Statistics have come out that strongly suggest the country has experienced a rapid increase in opioid abuse. In 1 year, the opioid crisis claimed the life of 47,000 people. 1.7 million people were suspected to be misusing opioids in some way at the time. And by misusing, they often mean that the person basically isn't taking their opioids that has been prescribed to them the way that they were prescribed to them. They may not even currently have an active prescription, but still taking them. They may be deciding to crush them up or basically take them in some kind of route other than what the doctor suspected, or they could just be taking a larger amount than what the doctor prescribed. What exactly is an opioid? Opioids are drugs that are derived from the opium. These drugs are very effective in blocking pain signals from the body, thus making them very, very useful in treating pain. Examples of opioids would be Oxycontin, Vicodin, fentanyl, morphine, Dilaudid, and even heroin. What makes them addictive? Well, first, for starters, they are extremely effective in controlling or eliminating pain. They can also cause sensation of euphoria for the person taking them. The person taking them can build up a tolerance, which diminishes the effects and makes the person require even more. And this all kind of goes in hand with itself. Like I said, first off, they're very effective in controlling pain. So first, it starts off as the person has some kind of issue with pain that they're prescribed medicine for, and then they find that this actually gets rid of my pain. And the fact that they cause some kind of euphoria or high for the person. A lot of people end up abusing them for this reason alone, but you add that in with the fact that you over time build up a tolerance, which requires that you slowly begin to have to take more and more just to receive the same effect that you did in the first place. This allows you to, or this makes you graduate to the point where you're taking way larger doses than anybody intended in the first place for you to take. How did it become a problem? It started when drug companies first gave out the false impression that opioids were not as addictive, and physicians and medical groups began prescribing them a lot more than they should have. Everyone thought that they were safe. No one thought that they were addictive. So, of course, they began just with widespread use, and everyone ended up receiving prescriptions for opioids very, very easily. People will also take them freely under the idea that they couldn't get addicted to them. They weren't afraid to give them to their grandmother. They weren't afraid to give them to their teenager. They thought that they were okay, so they pretty much used them pretty liberally. How bad is it exactly? Well, a lot of studies show that about 21 to 29% of patients given opioids for chronic pain do not use them as prescribed. Like I said earlier, they may use them a lot more frequently than the doctor intended for them to. They may take higher doses than the doctor intended for them to. They may even take them in different routes, such as crushing them up and snorting them, or any other kind of way that they can ingest it into their body. About 8 to 12% develop an opioid disorder, opioid use disorder. Excuse me. This is basically just them not using it as they're supposed to. It's estimated that 4 to 6% of people who misuse prescription opioids eventually transition to heroin. That's because heroin is still an opioid, but it's a much, much, much stronger, much faster release opioid. And a lot of people, they get to the certain point where their prescribed opioids aren't giving them the effect or sensations that they want to, so they decide to graduate to heroin. Right here, I found the chart showing the prevalence of it throughout the country. As you can see, Mississippi here, we rank in the 9.6 to 15% range. So it's not as bad as some places, but it's still in the intermediate range of use. In 2018, Mississippi saw 173 related deaths to opioid overdoses. And a very interesting fact I found out that 76.8 per 100 patients received an opioid prescription upon discharging the state. This is basically over 3/4 of all patients who end up being discharged from the hospital or from the ER end up with an opioid prescription to go home with. That's a pretty high amount, and if I'm not mistaken, statistics also show that that particular year, Mississippi was in the top 10 percentile of opioid prescriptions. Relations to infections. The use of heroin can be attributed to new infections such as HIV and hepatitis. In 2017, 86% of almost 45 new hepatitis C infections were related to injectable drugs. In 2017, that year also, 9.7 of over 38,000 new HIV cases were related to injectable drugs. This is because we know that a lot of times whenever people do partake in intravenous drug use, a lot of times they don't use sterile needles. The needles have been used not only repeatedly, but sometimes they've been used on other people, and that's just a very, very easy way for these kind of infections to be spread. Neonatal opioid withdrawal syndrome. This basically happens whenever the mother is pregnant but still abusing opioids, and when the baby is born, of course, because the baby isn't receiving opiates at that time, the baby ends up going through withdrawal syndrome. This affected about 7 out of 1,000 cases in 2016. Signs of addictions would be frequent use. The person's using it a lot more than they should be. If the doctor has it prescribed for 8 to 12 hours, the person's using it for 4 to 6 hours, or just more than they should be. Weight loss, poor hygiene, isolation from others. They may feel guilty for their abuse, so they try to distance themselves from others because they don't want others to notice. They don't want to hear any backlash or receive any kind of negative feelings from others for their addiction. Frequent drowsiness. Of course, opiates should make people drowsy, and if they're taking it more than prescribed, more than they should, you probably will notice increased drowsiness in them. And theft. A lot of times whenever these prescriptions run out, people, they have to turn to the streets to use the drugs. They'll end up having to steal just to get money for it, and take things from family members. They may take money, or they may take possessions from others just to go sell, just to get money for the drugs. Financial impact. The opioid crisis cost the U.S. what is estimated to be $78.5 billion a year, but sadly only 2.8 billion was for treatment. The total of the cost comes from things such as healthcare, rehab, involvement of the criminal justice system, things of that nature. The neonatal withdrawal syndrome births accumulated about 572.7 million in hospital costs. Methadone treatment, which would be per person, is estimated to be around $6,552 per person per year. And buprenorphine, so I hope I said that right. The cost of that treatment normally averages out to be about $5,980 per year, per person, of course. Costs associated with untreated addictions. Of course, if you overdose and end up in the hospital, that'll be an extremely high bill. So costs go towards that. Injuries related to use. Injuries could be some kind of infection that you would end up picking up from intravenous drug use. driving or performing some kind of activity while inebriated from opioids and cause yourself to become injured that way. The criminal justice, there's fees involved with officers having to arrest people and booking and housing them in jail. All this, of course, comes out of taxpayer dollars, but it still contributes to the total cost. And treatment for infants on opioids, going back to the neonatals who end up born and having to go through withdrawal syndrome, all that costs too. Drug diversion. Opioid addiction is also something that plagues healthcare professionals. Many sources estimate that 1 out of every 10 healthcare workers will, at some point in time in their career, have to deal with drug diversion. There have been many instances of healthcare workers illegally taking meds that are meant for the patient. They often find ways to retrieve or hold on to meds that are supposed to be discarded. You'll often see them frequently wasting stuff, or whenever they do waste, they don't actually get rid of the medicine. They find some kind of creative way to hold on to it. They may waste the pill and not actually waste half of the pill. They just find all kinds of different ways to hold on to the med. This can, of course, be a problem for the patient because, one, the patient might not be receiving the medicine at all, and also if the healthcare worker or the nurse is intoxicated off of the med, that could become a pretty dangerous situation for the patient and also for the healthcare worker, because a lot of times whenever they do get the drug, they feel the need to get it then, and a lot of times you can actually end up with an overdose because of that. Signs of diversion would be offering to pick up frequent shifts. They're just trying to get the opportunity to get drugs more. Frequent absenteeism. They might go missing for a whole hour at work and nobody knows where they are or where they've been, and they just pop up out of nowhere. Frequent med pulls or wasting, like I said earlier. They're coming up with all kinds of creative ways to get their hands on drugs and actually keep the drugs. Changes in personal hygiene. You'll start noticing their grooming just slowly decline. They don't take good care of themselves at all. And they'll start having elaborate excuses. They'll have long stories about trivial matters such as why they have to waste this med and why they've been missing for hours on hours, just things that you wouldn't think would require such an in-depth explanation. They'll be ready to give them. If you do notice you have any coworkers that you suspect of drug diverting, don't be afraid to speak up to the proper authorities. A lot of people end up not telling who they should because of fear of getting their coworker in trouble or what could happen to that person, but the outcome could be way, way worse if you do not tell the people that you're supposed to. This coworker could end up overdosing at work. This coworker could end up causing serious harm to a patient. This coworker could also get someone who's honestly innocent in trouble with them for their diversion. Always make sure that you tell the proper people as soon as you notice. Treatment. In 2016, in 2016, an estimated 2.1 million people had an opioid addiction, but sadly, only 17.5% of those people actually received treatment for it. Many methods of opioid treatment exist, but very few are actually utilized. Medicines such as methadone and buprenorphine are used to fight withdrawals from opioids. They act on the opioid receptors in the brain. They actually are synthetic opioids. They just tend to release a much slower effect on the brain, enough to keep the person from going through withdrawals, but not enough to give them that same high that they would if they were taking full-blown opioids. And that's pretty much what both are very effective in treating addiction to opioids. However, buprenorphine has been linked to a higher relapse rates because of tapering off of the drug. A bunch of studies have shown, for some reason, whenever people are taking buprenorphine, they tend to have a higher risk for relapse. Not exactly sure why. Treatment with methadone and buprenorphine is still controversial because at the end of the day, they are still opioids, and a lot of people feel that they're just substituting one drug for another. And sadly, this gives it a bad stigma and kind of makes a lot of people tend to stray away from it. They tend to try to go the cold turkey route or just complete abstinence, which unfortunately doesn't have as high of a success rate. Naloxone is a med used to treat overdoses and quickly restore normal functions. It's available in injectables that requires medical training, of course, an auto-injectable, and also a nasal spray. If it has to be used, the person who it was used on should be monitored by a healthcare professional for at least 2 hours. There are various centers for programs for treating opioid addiction across the country. Hotlines have been set up to help combat addiction. There are many different numbers, many different centers that you can go to. Too many for me to listen to this presentation, of course. But if you do suspect someone or have any issues with addiction yourself, be sure to look online and find out what kind of resources are available to you. Thank you.